Okay, well, good morning, everyone. My name is Douglas Dendy. With me today are my teammates Damian Salazar, Dylan Montgomery, and Riley Eggemeyer. For those of you who aren't familiar with our team and what it is that we're working on, we're working with the Texas Cotton Ginners Association as well as the USDA on workplace safety in cotton gins during COVID-19. Next slide, please. Okay, so just to quickly go over what it is that we're going to be covering in this presentation today. We're going to start out with a literature review in which we'll discuss the sources that we think are the most prominent in this project at this point in time. Then we'll get into some of the federal and state regulations that are affecting cotton gins right now. Then we'll discuss ginning in Texas specifically and the challenges that that presents. And then finally, we'll discuss where we're going to go with the project from here. And we figured it would be beneficial just to restate the problem as we understand it for everyone that's in attendance today. So current legislation in the United States has businesses operating within essential industries. They're required to remain operational throughout the pandemic. So the question, also cotton gins falls into this category. So the question that we have to ask ourselves is, how do we do this safely? And in this specific scenario, we're going to have to make decisions on things like separate non-local gin crews. So these are the crews that are coming in and operating the physical gin machinery at the workplace. And these crews are coming in and out of town quite frequently, by the way that we understand it. So we're going to have to make decisions there and possibly implement some policy that is just going to make that done in the safest way possible. And then, of course, things like employee housing. We were informed of the situation with employee housing a little bit, so we're just going to have to make decisions in that area and just make sure that it's being done in the safest way possible as well. And then, of course, the actual physical workplace safety. So any additions or alterations to the actual physical workplace just to improve the safety quality within the building. These are all things that we're going to be working on with this project throughout the semester. And like I said, we're just going to quickly go over the sources that we think are the most prominent right now. So the Proceedings of the National Academy of Sciences just released a report that contains a lot of valuable survey data that the group feels would be very beneficial when making decisions for this project. And then, of course, as well as the Centers for Disease Control and Prevention and the World Health Organization. You know, these are two of the world's leading scientific institutions that are doing research on COVID-19 all the time. So any guides published by either of these two institutions moving forward will likely be used as source material for this project. And with that being said, I am going to pass the reins over to Damian, who's going to continue the project for us.
Hello, can you hear me? Actually, yes. Okay. Sorry, I have issues with this. Howdy, my name is Damian Salazar, and I was tasked with looking at research for just rules, regulations, and stuff. And I wanted to start this with right now, like as of the 28th of January, 19 of the counties in Texas, they're all required to have a mask mandate. The reason for the exemptions for the 19, though, sorry. Yeah, reasons for the exemptions for the 19 have to do with the low infection count around the counties, and all of these counties have exemptions for children the age of under 10. So they are not required to wear any mask, and it's just the safest and best way to start with anything to prevent COVID is wear your mask, regardless of your social distancing. Anything, it will always help if every party is wearing a mask. Next slide, please. So OSHA is Texas is under the federal OSHA jurisdiction. So anything that OSHA says needs to be done, any standards, Texas will follow for private and public industries. And their biggest thing, again, wear a mask as often as possible. Do not forget. Also, wash your hands as often as possible, especially after touching your face and doing things such as eating, drinking, walking outside, touching a doorknob, whatever. You name it, you touch something, clean your hands, wash them. OSHA also recommends to have a workplace coordinator Basically, this is just have one person that can get all the details over everyone that has COVID, anyone that may have come in contact, whatever. You're feeling sick, report to the coordinator, and they will tell you exactly what to do. That is the biggest thing I've read and found while doing this research. And their main, another thing that's just to do is just proper measures to help reduce spread. Just keep in mind that there's still so much that we don't know, and so it's good to have that workplace coordinator. That next slide. So when we move on to CDC recommendations, being six, you need to isolate if you've been in close contact, and the CDC considers close contact to be 6 feet within 6 feet of someone for more than 15 minutes, providing care to someone, direct physical contact, anything where you're sharing, being around people, you name it. There's also, excuse me. There's also just many things that you want to do involve when it comes to using shared surfaces. You want to disinfect them after every use with. Sorry, next slide. I got ahead of myself there. Yes, cleaning and disinfecting the workplace. CDC says to use water and soap to just help reduce the area that COVID lives. And by doing this, you're just going to slowly decrease the amount of spread that will happen over time. Of course, that you definitely don't want to skip out on the disinfecting of surrounding areas, and this includes public open areas, closed areas, indoors, outdoors. It doesn't matter. They recommend that you use their EPA list in disinfectants, which some examples are just different Maquats, different varieties, mostly is what they have listed. But if any of those are unavailable, you want to use just a bleach solution and just heavily clean a surface, let it dry on its own. You should be good to go there. But common surfaces you want to clean, just anything that's shared in the workplace, such as phones, countertops, anything with a touch screen, keyboards, main things like that. Just be sure that you have everything just well done and clean. So I will pass this off to Dylan now.
Good morning. My name's Dylan Montgomery. I'm just going to kind of cover just ginning in Texas, kind of in general. So in Texas, we have over 200 operating cotton gins and over 900 operating gins within the United States. Majority of them are located in rural areas, meaning majority are located in counties with no mask mandates. For the cotton ginning industry, it's primarily ginning through October to December. Sometimes that's early, sometimes it extends a little through December. So for a majority of the beginning of COVID-19, gins did not have to, we're not working at full capacity during the start of the pandemic. But these past few months have been when they've had to make adjustments based on how they've been working. Gins mainly operate off seasonal workers, so large crews of sometimes migrant workers, sometimes people that are from the community that just help out during the peak seasons. So COVID-19 and cotton gins, they're not just worried about spreading COVID within the gin. These seasonal crews often live together in close quarters, so that means that they need to fight it both when the workers are away from work and also when they come back to the gin. An outbreak in the living quarters could spread within the gin and cause a total shutdown, which is one of the major fears of not catching an outbreak soon enough, is that the gin could have to shut down as a whole. So ultimately, for this project, we realized that we're going to need to fight the spread at the gin, but also fight it while workers are away from the gin, and finding ways to make sure that these crews adhere to different guidelines to help prevent the spread. So some industry practices, like I said, majority of cotton gins are located in rural areas where there's no mask mandates. So a majority of cities or towns where these are located, people are not required to wear masks when going to restaurants or going around town. So it kind of limits how much workers can go out. If you're trying to reduce the spread at your office, they can't really go out and sit at lunch with 30 other people who aren't wearing masks because they could risk catching it and bringing it back to the gin. Distancing can be very difficult depending on the size of the gin. Gins range in various sizes from small crews to very large crews, and the insides of gins can be very cramped depending on the gin. So many of the safety protocols that I've seen being around gins are kind of at the discretion of workers. Many workers I've seen, even in gins where there's no mask mandate, are wearing masks. They're trying to physically distance because they want to work just as much as their bosses want them to work. So they're trying to keep themselves healthy so that they can get the ginning done and be done for the season. I've also seen gins reducing their size of their shifts to try to reduce the number of people within the gin. So gins that normally operate 24/7 with a day shift and a night shift, this season switched to 12-hour shifts with only one crew. That way there was no worry about spreading between two different crews when they would go home or come back. So those are just some industry practices that I've witnessed firsthand. I'm now going to kind of pass it off to Riley and let him kind of wrap things up.
All right, thanks, Dylan. Like you said, my name is Riley Eggmeyer, and just to kind of sum up everything that we've talked about today, we talked about our problem statement, which we're just trying to find an efficient, cost-effective, and viable option, just looking to minimize the spread of COVID-19 in the ginning workplace. The main way of transmission are people just not wearing masks, not social distancing, and lack of sanitation, which these basic procedures have already been set into place in these cotton gins. It's just simply not efficient enough. Because of the different ginning seasons throughout Texas, it can be difficult to keep up with all the regulations because they might just change from month to month and just possibly even from week to week. Speaking on the literature review, we had the proceedings of the National Academy of Sciences, which they focus on how COVID will affect small businesses and their employees across the country. Their survey shows the economic data of businesses in each state and highlights that the areas where they are struggling. The CDC has published many guides in helping businesses operate safely. These guides include suggestions on how to take advantage of government assistance and meet those specific requirements. The federal and state regulations, with Texas being under the federal OSHA jurisdiction, proper ventilation, using the right PPE, routine cleaning, and disinfecting, or using physical barriers to distance people in close proximity, keeping infected people away from workplace. The CDC recommends that anybody being in close contact should isolate for 14 days. And ginning in Texas having the majority of the U.S., putting them at having 200 gins out of the total 900 in the U.S. Their busiest months are usually from October to December. Most of the gins with their workers being migrant workers, they all having to live in close quarters. So if one of them are going to catch COVID, then most likely all of them will catch it. So this can just mean one of them going out on the town or something and coming in contact with someone just at the grocery store. Coming back, they will get everyone infected and having the entire ginning operation go to a halt. So you go to the next slide. Where we're at today, we just need to finish up and finalize our background research, making sure we have all the information we need as of moving forward to our potential solutions. And doing so, to finding our potential solution, we seek to find the most valuable and efficient way to exterminate the spread of COVID throughout the gins in the U.S., not only in Texas. So as we wrap that up, our next progress report, our meeting will be on February 23rd. And if we can entertain y'all, if any questions, we can do so.
Yeah.
I'm sorry, Colonel. We can barely hear you.
Yeah, we can barely hear you, but I heard, do you have any comments? So I'll take it and run from there. Have you guys looked at the OSHA guidance that came out maybe Monday or Friday? The new administration has posted new guidance, and I haven't read them. I'm not. It's Friday. It came out Friday.
I know I personally haven't read into them yet. I'm not sure. Dylan, have you looked into that, or Damien?
No, I haven't seen the newest ones. The last ones I had seen were about mid. It was about mid last week.
Yeah, I haven't read the newest ones, but I'll definitely make a note of that, Kelly, and make sure that we read through those and just get the most up to date.
Yeah, I mean it never ends. I haven't
Yeah,
read
it
them
seems
either.
like there's something new every week.
Yeah, and it's probably worth looking at. I think they put up a coronavirus page now at OSHA or depart. Yeah, it's the Department of Labor, but it's in the OSHA section. It looks like, and so that would be one thing. Have you guys thought about one of the things that we keep hearing? And so you have workers come in and they have all these scenarios. Okay, well, my cousin's boyfriend has COVID. We just found out, and I was with them at a party over here, and there's all these scenarios, and I've wondered if it would be a good idea to build like a matrix where you answer yes or no, and then you go down as you go, because I mean, there's a difference. Like we've got situations where there's a lady working in the office, and her husband's actually tested positive. Well, or another lady whose husband's a teacher, and one of the teacher's students tested positive. So the husband's potentially exposed, but maybe not, and versus another husband who's actually got it. And you go through all, and a lot of the managers are just, they just scratch their heads and go, oh my gosh, okay, what about this scenario? And the interesting thing is we're finding nearly all of our scenarios are something happened outside. I don't know. I think it's worth thinking about, how do you, if this is like a book that the manager can use, how do we make it useful for them? And that's the one thing that I think is confusing people the most now is trying to figure out, how do you know an employee in this scenario, what do I do with them?
Yeah. No, I think it primarily goes around like contact tracing, that type of stuff. Like, the government's doing that, where if somebody tests positive, they'll see who's been close to them and all that kind of background looking into it. And I think y'all can do something sort of kind of like that at your business, where if you kept a record of everyone who's been potentially in contact with it, and then kept the record of employees who have been in contact with them. I think that would be really beneficial moving forward, and just kind of keeping track of who all potentially could have COVID within the building.
Well, but that's not really the question. The question comes down to, okay, I've got this person, and in under some scenarios, they just have to stay home 14 days. Under other scenarios, they need to stay home until they get tested. And okay, for that, do you wait 3 days to get tested? Do you wait 2 days to get tested? Okay, now there's another scenario where the husband's a possibility, not the worker. So then, okay, the husband needs to wait 2 days to get tested, and then, or 3 days to get tested, and then the employee needs to wait 3 more days to get tested. And it's not 14 days, it's actually, but it's not 3, it's 6. And it's all of those kind of scenarios, and it's nearly always outside sourced.
Yeah, always outside influences.
I see what you're saying, Kelly, about trying to do some kind of flow chart or something where you respond to questions, and if you respond yes to this question, well, you need to do this, and if you respond no to this, you need to do something else. So I get what you're saying, and kind of a book kind of thing that a gym manager could look at and just say, well, if you were were you exposed, to somebody for 3 days, and if 3 or more days, and say if yes, then you need to go get tested and you need to quarantine for this amount of time. So I do think that would be something that could be beneficial, kind of a questionnaire kind of flow thing, just to
Right.
give some guidance.
Like you're saying, just use some sort of matrix to go off by, and like you said, if it's this, you got to do this, and just make sure it's something just goes along the lines of that. So
It helps them think through it, because there's 14 days, there's 3 days, there's 6 days, and if you've got 3 people in your office, if you're constantly sending them home for 14 days, you're not going to have anybody there in a lot of cases. And the workers are like, I don't want to be gone for 14 days. I think I could go get them. We've had them where they were exposed Thursday night, Friday morning they got tested, and they're like, I'm good, I can come back. I'm like, no, you can't do that. You have to wait. And so it would just be helpful to have some scenarios laid out for these guys. I think that's the biggest thing we're seeing, is just confusion in the trenches as you're going forward.
Yes, sir.
But it looks you guys are, I remember thinking when we put this one together in August that, shoot, by the time you guys got working on it, we'd probably be done with this deal, but it is not turning out that way. I'm glad you guys chose our project.
Thank you, sir.
All right, can y'all hear me?
Yes, sir.
Yes, sir.
Okay, y'all just kind of speak over toward this microphone. Team 2 is going to make some comments.
Thought the opening was really good. It was very metered and concise, and it kind of transitioned easily into the front of the subject. One thing I would say personally, I think, and I get that it's kind of an advantage being online, is trying not to read whatever they've written down, trying to have it a little bit more. And I understand that's kind of an advantage online, but it's better.
Any questions from Team 2? Couple comments.
I was just going to, maybe at this time, do they have any working ideas of where they want to go with the project?
I don't think we have anything set in stone yet. I think it's a little bit too early to answer that question. There's still a ton of kind of background information that we got to look through before we can really get into any potential final solutions yet. But that's a really good question. We'll definitely be thinking about that a lot moving forward.
And I think there's kind of the general kind of mask and 6 feet of social distancing that we're already seeing in most things. So kind of weighing continuing those options, but also the idea that Kelly gave us for some kind of decision matrix that gen managers can use to try to I think that's definitely an idea we're going to look more into, especially since that could be prove effective in coordinating quarantines and different things to make sure that you do have people in the office and you're not sending everybody home in one day because you're making decisions that, if you had a plan laid out, you could make decisions much easier than just making them on the fly.
All right, good. And, Team 9. Okay, let's move along, and Dr. Kistel will make our comments.
Okay, can you hear me?
Yes.
Yes.
Yeah, I also like the opening introduction to the problem and the explanation of the different regulations in Texas. I think that helps the audience to understand what you plan to do. I personally am not familiar with a cotton gin at all. I wish I could go and visit one. So I would have liked to see maybe a figure of the standard layout. And Mr. Green talked about having 3 people in the office. I didn't have any sense on the number of people who actually work in a crew. So what is a large crew versus a small crew? So I would have liked to see some figures and numbers that would have helped me understand what you were saying. I can sense it, but I didn't have a good idea. So I thought that was missing in your presentation. Otherwise, you distributed your talk well. I also would like to see again the gene. How many people are a small crew? Can you tell me? What is a small crew? How many people work in the actual gene?
I think Dylan's familiar with that more than the rest of us. So
I mean, for a small crew, I mean, small crews that I've seen could be, around 10 people. Just depends on the size. Actually within the gin, offices can range from, one office manager and a gin manager to up to 5 or 6 people, depending on, peak time. So you could have 5 or 6 people in the office. You could have small gin crews of 10, sometimes less, and then large gin crews could be, 30 or more people, depending on the gin.
Okay. So I believe your next step will be to address solutions for both sizes, right, of groups, small
Yes, ma'am.
Yes.
and large. And I think you should take the advice of your client regarding that matrix and that flow chart, finding a way to really track down and decide who's coming to the office or not. Otherwise, good job.
Thank you.
thank you.
Okay, let me make some comments. Yeah, your length of your presentation was right at 15 minutes, so good job. I don't know how much y'all practiced it, but you really nailed that. And yeah, your distribution of time between each of the members was very equitable. Douglas, I thought your introduction was very strong. Good job.
Thank you.
Put up your problem statement again. Let me critique that a little bit. Okay. So my only issue with this problem statement is it's pretty general. The word safety or safely. My immediate question is, well, what aspect of safety are you going to address? The assumption is it's with regard to the pandemic, but there are many applications of safety, the injuries, and like that. So I think you probably need to be more specific in your problem statement. Focusing your
cutting out.
I'm sorry, Colonel. If you're still speaking, we can't hear you currently.
Okay, so my comment here is your problem statement needs to be more specific to the pandemic because safety has a lot of applications. I would just recommend that you put on this slide, and when you're talking about safety, talk about the aspect of safety with regard to prevention of spreading the pandemic.
Coronavirus.
To make that a little more
Gotcha.
clear, that'd be good.
Okay. Yes, sir. Thank you.
Go to your literature review slide. Okay, these look like really great sources. What I was expecting, and maybe Damien did this, but I was expecting to see at least one slide for each of these. This is a great intro slide. I was expecting the next slide to be, and here's what we got out of the proceedings of the National Academy of Sciences. Okay. Now, Damien talked a lot about the CDC guidelines. I don't remember specific, and maybe he did World Health Organization too, but so y'all answer this question. Did y'all actually hit each one of these in your presentation?
I'm not sure if we really dove very deep into the PNAS source as much as the CDC, and definitely I don't think we touched on the WHO very much.
Okay, so let me ask Damien. Damien, go to your CDC guidelines slide. So did this come out of the literature review from the CDC?
Yes. So this came from the CDC, as well as who the WHO also has a lot of the similar things. So they kind of all came from like together onto the CDC one, which I forgot to change it from CDC recommendations to just like the generic overview of what they all had in common with everything, which because most of these, like all of the things which that the CDC considers close contact, WHO and OSHA themselves, like they all had similar guidelines, the 6 feet apart, caring for people, things like that.
Okay, so that's what I'm critiquing is
Yes.
maybe your organization, your presentation. You kind of promised me you were going to talk about these 3 literature review things, but I didn't feel like you carried out on that promise. Okay, so go back a slide to your Texas mask mandate slide.
Russell, can I throw something in real fast?
Yeah, of course. Client.
From what I've been able to tell watching this stuff, guys, as a practical matter, everybody's following CDC. If your root source is CDC, you're probably in good shape. That's just my feeling.
Okay, we'll keep that in mind moving forward. Thank you.
Okay, this slide, I immediately I focused in on 254 counties have a mask mandate exemption, and it wasn't really clear what you're trying to say. And it's only now that I'm reviewing it that I'm seeing that it's only 19 out of 254.
Yeah,
So, I think what you actually said here was all Texas counties have a mask mandate. Is that true? And
yes, the latest
really,
thing.
What does that mean? Mask mandate could mean that you have to wear a mask 100% of the time everywhere you go, and I don't think that's what that means. So I'm not asking you to explain this, but I'm just saying be a little bit more clear and perhaps cite the source of where you got this information. Go to your OSHA slide. Here you got into standards and regulations, and OSHA is kind of the big behemoth there with regard to standards and regulations. I'm going to critique a couple of your terms here. The word jurisdiction, I think, is probably not the best term here. Jurisdiction is a legal term regarding law enforcement and things like that. And OSHA is not law. So you'd probably say Texas is subject to federal OSHA regulations would be a more appropriate way to say that. Jurisdiction kind of implies that somebody's going to come slap cuffs on you if you break their law. So that's a little bit too strong a word there, and I'm really getting down in the weeds there. But that's an issue I've heard before.
Yeah,
I felt like when you were presenting this, you were almost presenting this like, well, here's the solution, and obviously this is not the part of the course where we're getting into solutions. So I think your presentation here should have been, here are recommendations that the OSHA recommends, but you transitioned your language into be more, you should be doing this, you should be doing that, which of course is what the regulation says. But I would probably not state it in terms of here. So here's our solution: follow these guidelines. You're trying to present, here's what the guidelines are. The real challenge for this, and I'm just going to transition now to my general comments. We all know this. You haven't presented, there's nothing on this slide that we haven't heard for the last 10 months. So your challenge in this project is how are these going to be specifically applied to the cotton gin environment? So that's where y'all need to go in terms of your solution is, you're at the end of the semester, if your solution is just wear a mask and wash your hands and social distance, you really haven't told the client anything. So you've got to really be specific on how are they going to comply with these things in a challenging environment like a gin, where there's going to be difficulty in doing these things, or maybe not. So I think as y'all get into your next presentation, flow analysis and all that, you're really going to have to, as Dr. Castell kind of pointed out, identify what the size of the crews are going to be, the different ranges of crews with the different sizes of the gins, and figure out, what some of the problems are going to be in that regard. One other thing I was looking for here, it was some data from the Texas Cotton Ginners Trust. They're kind of the safety and insurance folks for the Texas cotton gins. I'd be interested to see, and maybe y'all can hit this next time, is how many gyms have actually had to shut down because of coronavirus breakouts in their workforce, that kind of stuff. But that can be part of your next presentation, I think, in flow analysis. Okay. Any other comments? Oh, Dr. Harden, are you on? You got any comments?
Yes, no, I thought that was a pretty good job. I do have a question, and I was a minute or two late before I could get on, so I apologize. I think you were still in your introduction. Have you looked at any sort of, trying to think what the right term is, kind of job analysis where you're looking at what people are doing in the gym, or have you been to a gym to kind of see where where potential problems are for where we might get transmission? Because a lot of times in the gym, the gynners at the console, the bell press operators, people are somewhat distant anyway. So have you looked to see where there might be some problems that y'all can come up with some solutions for?
I think I can definitely try to get some more information from managers or something about where they think there could be potential issues. Like you said, a lot of times machines are spaced out, so when they're operating, they may already be distance from each other. But yes, there definitely could be those. When a truck driver pulls a bale into the module feeder, he making sure he doesn't get out of the truck, and go chat up the guy on the module feeder, stuff like that. Because I've definitely seen that happen where
Right.
the truck driver and the module feeder, they see each other all day, pulling bales off the yard, and they want to chat each other up. But that's kind of something we don't kind of make that kind of a regulation, like truck driver needs to kind of distance from, he doesn't need to be getting out and going in the office and talking to people, or getting out and talking to the module feeder guys. So yeah, I definitely think that's something that I can try to get some more information on, because I think that's definitely something we need to look at.
I think that's a good point, and I think that's kind of the direction I was heading. I think a lot of when you're doing your job in the gym, you're not necessarily near other people, but it's times like that, or you take a lunch break, and that's where you're going to be in closer contact. The other question I had, and I
Hang on. Yeah, Dr. Harden, we got to switch over to our
okay,
next.
great.
So I would ask you to send
I
that
can
directly.
stay in touch with them later. Thanks.
Thanks. Okay. Hey, good job, Team One. Thanks for being the leadoff hitter. Y'all set a good standard here.